Good morning.
Looking for my counterpart, but I share my screen. Can you see my screen, Kimberly? Yep. Okay.
Yep.
Awesome. Rosie, can you let me know if you're in the lobby or in the room?
Don't see.
You know, Michael, while I'm on hold, there's some leftover stroke in the fridge.
Wonderful.
Oh, I'm so glad I did it. Now I know.
Nikki, did you hear from her?
No, I just messaged her. I said, "Are you in yet?" So
See.
Good morning.
Good morning. How are you?
good morning.
I'm so glad it's Friday.
Me too. Girl.
So Kimberly, she said she registered but does not see the link to sign in.
Weird. Okay. Me. I don't usually have problems with Teams on this with this stuff, so that's weird that it's not, because it should be a whole series that got sent.
Yeah.
Um,
Let me see if I could forward her what you sent me. It's weird. It's not letting me forward. It's only letting me reply.
I know it's not letting me forward either. Here, I'm gonna put this in the chat, Nikki, if you can shoot it over to her.
Let me stop sharing.
Oh, okay. I'm also not used to having to admit people in. Usually they just.
Oh, well, thank you for of doing that for me. I appreciate it.
Oh, interesting. Well, we had so this was originally a Zoom setup, and there's Rose. But we recently lost our Zoom licenses, so we've had to move to Teams webinar. So we're just learning what's working and what's not. It should be a series you guys got sent out that you could register for. So I'm gonna have to go in and look at it after today and see what's happening, because it shouldn't have, other than a Zoom link, the only other thing that's there is the Teams link. So, and I thought they were going to cancel the Zoom. So we might have people over on the Zoom one waiting to get in. I didn't even think about that.
And you're welcome to go check that, Kimberly, if you need to. And you can come back.
Yeah, I might need to do that. I will be back in just a minute.
Okay, no worries. I'll admit people.
All right, thank you.
Thank you all for your patience. It's a new platform that we're presenting on, so as you all know, some little bumps in the road, so we'll get through it. Just give us a moment, please. And I'm admitting people right now, so just give it another minute or so. So, because there may be people that are in the Zoom link still. And Rosie, can you hear me?
Yes, I can hear you fine.
Okay, wonderful. Good. Good. Wanted to make sure. Yeah, it's
Yeah,
a
the
little.
slides look good too as well.
Okay. Thank you. Wonderful. Yeah, we're just getting through this little bumps right now. Admitting people in, and it's just a new platform. And as we know, there's some challenges. Usually there's a lot more people here, so they may be in the maybe in the Zoom link. Happy Friday, everybody. Does anybody have some fun plans for the weekend?
Not working.
Oh, it's not. It's
Oh yeah, we got the Super Bowl this weekend. That's right.
oh yeah, duh. You mean the
Go
Bunny
Hawks.
Bowl? It's all in the Bunny Bowl. That's why I'm watching. I don't know who's playing. All I know is Bad Bunny's playing. That's all
It's
I
a
care
big
about right
deal
now.
here because the Seahawks are going to the
Oh
Super
yeah, duh. See,
Bowl.
who's in the Super Bowl? I didn't know Bad Bunny's at the Super Bowl.
I watch for the commercials. I'm not gonna lie.
Yes, me too. Me too. All right, so I am, and Rosie, can you keep an eye if there's questions that come into the chat when I'm speaking and when you're speaking, I'll keep an eye on the chat as well. If there's
Yeah, of
questions that
course.
come in. Thank you.
Mhm.
All right. And then Kimberly, you'll let people in as they
Yeah.
trickle in. Wonderful. All right. Well, let's go again and get this party started. It's not a Super Bowl party, but well, and I'm not, as entertaining as Bad Bunny, but we'll do what we can do. All right. So today, we've heard a lot of feedback about connecting supportive housing to supportive employment. And we thought today we would talk about the importance of supportive employment and its connection to supportive housing. And if you're not familiar with supportive employment, we're going to do, we're not doing a deep dive, but we're going to do kind of a high level overview of supportive employment and its connection to supportive housing and the importance of, of these two um, areas. And your community does a lot of great work with supportive employment as well. And if you're not familiar with a lot of those programs, I'm sure we can give Kimberly a few minutes at the end, or she can chime in and talk about that. But we'll go ahead and get started. So this session is Supportive Housing Works Better with Supportive Employment. This is the learning collaborative that we do monthly with the Washington State Healthcare Authority. And I'll just kind of introduce myself really quickly. If you guys are not familiar with me, I've been working with you all for about a little over 2 years now. And I really love the state of Washington. I love the work that you all do. You all are innovative, way ahead of the curve with a lot of other states across the country that I work with. You guys are very progressive. And so I've been working to end homelessness and provide housing to people for over 20 years now. I am a senior consultant too at Advocates for Human Potential. My passion is ending homelessness. And I really believe if you don't have a safe place to live, nothing else matters. So I'll go ahead and turn it over to my partner in crime today, Rosalinda. You want to go ahead and introduce yourself, Rosalinda?
Yeah, thank you, Nikki. Hi, everyone. Nice to meet you all for the first time. So I'm a program associate here at Advocates for Human Potential. I come with a background in community health, and behavioral health. So I worked a lot with nonprofit organizations in the past, just on how to integrate peer services and how to enhance their clinical models to provide more outreach. So I'll be, you'll probably be seeing a little bit more of me moving forward. I'll be working with Nikki and just assisting her with some of these webinars. So I'm excited to dive in to the webinar presentation or the Learning Collaborative presentation today and just see everything that you all are doing. I've heard a lot of great things, so I'm excited to get to meet you all better and the work that you do. Thank you.
All right, so I'm going to go ahead and get us moving. Thank you, Rosie. All right, so today the session objectives are reinforce why supportive housing is an evidence-based intervention. We're going to talk about understanding how supportive employment strengthens housing outcomes. And we're going to connect, we're going to connect employment to cost effectiveness and system sustainability and identify practical ways providers can integrate employment supports and address common concerns and implementation barriers that we've seen. And again, Rosie, if you see anything or if I missed anything from the audience, just please let me know. So a warm-up question. And also, Rosie, I'm not able to see my notes. So if I go, I don't want to step on your toes. Whoops. And so if there's any, if you say, hey, Nikki, this is my slide, just jump in there. Stop me,
Oh, okay, that's
please.
fine.
Because for some reason I can't see the notes, of course.
Okay, sounds good.
So how does your organization define supportive housing and supportive employment? And how do these models connect in your service delivery? Does anybody want to come off mute or use the chat? So you guys familiar with supportive employment? I know you all are familiar with supportive housing because that's a lot of what you all do. Anybody want to use the chat and talk about that? Come on.
It's a quiet group today.
I know, usually you all are talkative. All right, I see somebody. We use the housing first model, meet members where they are, but not getting attached to the outcome. Good. I'm glad to hear you're using a housing first model. And do you guys use supportive employment as a part of that model? Nice. Okay. Said yes. Supportive housing and employment go hand in hand and can increase one's ability to meet their needs all around. Good. It's great. That's exactly what we're going to talk about today. It's working within fidelity standards with integrity and client choice. Really good. Really great answers. I'm sure Kimberly's happy about that, those answers. All right, so let's go ahead and move on. All right, so the first part of this, we're going to talk about supportive housing is an evidence-based intervention. So grounding the conversations, sorry, this is coming up on my screen. Grounding the conversation. So what do we know about supportive housing? We know it works, right? We know it saves our community money because when somebody's in housing, we know that it is more likely that they won't hit the emergency rooms, hit the crisis centers, all of those types of things. And it helps improve people's lives. And what we don't always operationalize is we need to consider how employment fits into this model without compromising the housing first principles, as somebody had indicated earlier. And, we often say it's housing first, not housing only. So supportive housing, the evidence base. So how supportive housing has worked, it provides, of course, permanent and affordable housing. It offers voluntary and flexible services. And, I often say this too, is that the services are voluntary and flexible for the people that we serve, but not for us as service providers. If you're a service provider, your job is to continue to offer those services until somebody says yes. And I would have people that would tell me no so many times, but when, but they would one day they would say, hey, yeah, Nikki, I really need those services. What were you talking about that other day? So we can offer stuff to people multiple times, and that's the flexibility of the services that are provided. And there's a separation of housing and treatment services, right? So that's one of the fidelities to the model, is a separation of housing and services. Your job as housing providers is to support that individual in their housing and keep them housed. And it's also focuses on harm reduction, right? And recovery oriented approaches to this. And those demonstrated outcomes, we know that there's higher housing retention rates when people have those supportive services that are voluntary and flexible. We also know, of course, that it reduces homelessness, which is, of course, we see is on the rise all across the country. It also improves the health and safety of the community and the individual and their family. So how supportive housing looks like in practice. So what works to reduce homelessness? We know supportive housing, removing access to barriers for people to go into housing, as somebody indicated earlier, around housing first. So reducing those barriers for people to access housing and building, of course, more housing. We all know we need more, I don't want to say just housing, but we need more affordable housing. And preventing the inflow. And that means preventing people from going into homelessness and using data to drive those stories. I think it was last week or the week before, Rosie and Christian did a really great presentation to the SECC committee around using data to tell stories. And we know data is how we know the interventions are working. Again, these are evidence-based practices. We have the evidence and we know they work. So, and for provider level outcomes, there's fewer returns to homelessness, there's improved tenant engagement, better care coordination, reduced crisis response. People aren't hitting emergency rooms. People are not hitting, not hitting the crisis services. They are more stable tenants. And many residents remain economically, I'm sorry, and can somebody mute their phone? Or can we mute that for them? Whoops.
Yes, please.
Can we mute Rosie or?
Yeah, I'm working on it.
Thank you. Because I get distracted very easily. However, many residents remain economically fragile, and that's where supportive employment comes in. So stability versus self-sufficiency gap. So housing stability is necessary, but not sufficient. So common provider realities are residents rely on very limited fixed incomes, right? We know that a lot of the people that we serve are either on SSI, Social Security income, or Social Security Disability Income, SSDI. So these benefits alone rarely cover the basic needs that people meet. I mean, we all know that food is rising, health insurance is rising, or, everything is rising right now. And rents, of course, are rising. And the financial stress can destabilize somebody that's in housing. And long-term poverty, sorry. Long-term poverty undermines recovery. So this is where supportive employment becomes very critical to someone's success. So part two, supportive employment strengthens housing outcomes. So we're going to talk about why that is. So what is supportive employment? So the core principles of supportive employment are competitive, integrated employment. This is folks that can go and be integrated into any job or organization, and it's competitive, right? They're not just getting the bare minimum amount of money. They're able to get a competitive salary. They're integrated into an employment environment. And it's also person-centered and voluntary, right? We don't say you have to have a job to be able to get into this supportive housing program. It's also rapid job search aligned with the participants' goals. So the clients or the members, whatever you guys call the folks in your program, it's aligned around their goals. So if I want to, work with animals, I'm able to go, if I'm a supportive employment specialist, I'm helping that person meet those goals and to be able to connect with an organization that serves animals. Ongoing flexible support. So supportive employment is kind of like supportive housing, right? So the idea is that you're supporting somebody while they're in a job. So you're there for them, you're supporting them, maybe connecting them to additional resources like bus passes or food resources or whatever that is to keep them steady in their job, and keeping and teaching them those conflict resolution skills, all of those types of things that we all need to do to keep a steady job. And it's also integration with behavioral health services. So making sure people are, not making sure, but supporting people taking their medications or attending their appointments or getting, counseling, whatever they need to keep them stable. And the key point is employment is a support, not a requirement. Kimberly, anything you want to throw in there?
No,
If not,
not, not right now.
if not, no, it's all good. I'm just, all right. Okay, so employment and housing first is not a conflict, and people often think it is. So clearing up those misconceptions. Housing first, like I said, it's housing first, not housing only. So housing first means housing is not contingent on employment. So it doesn't mean, oh, you have to get a job to maintain this housing. Services are voluntary, as I talked about earlier. And the services, everybody's services are not the same, right? Everybody has individualized services. So what Rosie wants and what I want are two different things. Those services should be unique to that person. And people define success for themselves, right? I don't know what Rosie's success is, and she doesn't know what my success is for me. Supportive employment emphasizes and honors choice, right? The choice. Choice is huge, and that's part of one of the fidelity models to supportive housing as well. So, supportive employment also emphasizes sports readiness at an individual's pace. So, it's where they're at, and somebody put this in the chat, meeting them where they're at. And it aligns with recovery oriented care. What are that people's recovery goals are? It aligns with those things. And both of these models are philosophically aligned. And supportive housing, we know, improves outcomes. So those improved outcomes includes long-term housing stability, improved mental and physical health. We know that this improves people's health, that there are long-term studies that have shown this. It reduces substance related harms. It increases community integration, and employment strengthens every one of these outcomes. So how does employment improve housing retention? Because we know providers see better stabilities. Employment contributes to increased income for rent, utilities, food, or somebody wants to go to the movies or whatever their hobbies are, right? And we want people to be integrated in the community and feel a part of it and can go do those things that they want to do, instead of being, if you're on a fixed income or you're only relying on the housing subsidy, you're not able to be the whole person that you want to be. Predictable routines and structure. Employment offers all of these, right? Somebody knows, okay, I have to get up, I have to be at work at 8, I wake up at 6, I get on the bus, I have breakfast, all these types of things. So it creates structure and routine. And it also builds stronger landlord relationships. It also reduces eviction risk. It has people have greater personal investment in their housing. And it also builds people's self-esteem. And providers often report fewer tenancy crisis when employment is present. Because people are not home all day, with their friends hanging out. We know that it increases better outcomes. Is this where you start, Rosie? Or am I
Yes.
missing? Okay, great. All right.
Yeah, thank you,
Turning
Nikki.
over to my colleague, Rosie.
Thank you. Okay, so as Nikki was talking about, including that supportive employment component with alongside supportive housing can really uplift and positively impact behavioral health outcomes. So as we talked about, supportive housing or supportive employment leads to improvements in income, to daily structure, because that way folks are having that routine getting started that can help them with their, daily structure. They also have increased social support, whether it's, at their job site with, their social circle. This can also lead to more community integration and illness management. So as Nikki was talking about, individuals who are being supported on both ends for supportive housing and employment, that leads to a decrease in hospitalization rates and just illness overall. People who are employed experience fewer emergencies and hospitalizations, which can help to improve these behavioral health outcomes. And then supportive housing also actualizes the recovery paradigm, and that means, people who are in competitive jobs or in jobs that they're passionate about, they're more likely to develop that self-purpose and, bring meaning to one's life because they feel like they are a part of something that they like to do. They're being supportive to do that and take that next step. So it can support with, developing that purpose and also leading to overall decrease in social factors, because now they're being housed, they're being supported. And as Nikki said, also having that supportive employment can also help with, reducing eviction risk or any of that stuff. Can you go to the next slide, please? Thank you. So now talking a little bit more about community integration and purpose and what does this mean? And this is, beyond just being housed, but this is also speaking in terms of how supportive employment also supports with, having this community integration. So supportive employment fosters community integration and the purpose by, placing individuals with behavioral health needs or, receiving services into competitive and integrated work settings during this they'll also be receiving a lot of like on the job coaching and which can lead to a lot of personalized skill development, and this model of incorporating both of these components in there also promotes that social inclusion. It reduces isolation in the long run. In the long run, it builds independence and improves self-esteem. So, yeah, like it says here, employment helps with creating that social networks, building natural supports, reducing stigma through participation. And, with this, individuals will have the opportunity to work with, others in their workplace to build and foster those relationships. They're going to, be able to build some new skill sets and can also create a sense of belonging, in the long run. And integration also facilitates easier access to community resources, healthcare, access to education, otherwise that they probably wouldn't have received or would have just taken a little bit longer to get there. So, it's important to remember that these are all core goals of supportive housing, and, combined with supportive employment. So, next slide, please. Okay, so now we're going to move on to how to connect employment to cost effectiveness and what are some of the benefits of that. All right, so how does supportive employment increase cost savings? So supportive employment, which we're going to talk about, and I know
Taking
Nikki
a lunch,
also
Trina.
touched base a little bit
Oh,
about this
I'll do it.
earlier.
She sent me a new one too.
Oh, I think there's someone
You mute yourself, please.
I don't know how.
Thank you.
Yeah.
Um, So supportive employment, it reduces their reliance on crisis system. Like we talked about earlier in the slides, if folks are being employed, if they're consistently receiving those access, that support system, it'll reduce hospitalizations and even like crisis in the long run. Supportive employment will increase cost savings by reducing the reliance on public health benefits such as Social Security or others. Um, and, it'll also decrease the need for high intensity services over time because again, this is something that they're continuously working on. They're getting that support. And, whenever you have that employment too, even some employers, they offer healthcare services within or like benefits or anything that they'll be able to qualify now that they're employed and continue receiving that support apart from what they're already receiving at your organization. This will also support with shortening the duration of public assistance when appropriate and improving the long-term system throughout. So even while the initial setup costs, there might be initial setup costs at the beginning, supportive employment, such as like the individual placement and support model, these all become more cost effective over times as participants maintain stable jobs in the long run. Next slide, please. Okay, so now moving on to provider level cost impacts. So when housing stability and employment supports are addressed together, these are a few things that providers are able to experience, are able to see. So one of them, as we talked about, fewer emergency interventions, walk-ins, and any last minute like schedule disruptions, crisis after hours crisis care. They can also see reduced reliance on mobile crisis teams, after hours coverage, and on-call staffing, which can lead to reduced staff burnout for folks in your organization. This can also lead to, more manageable caseloads, again, because the rates of, people coming in after hours for crisis care are being reduced. This can also lead to more predictable service patterns, so allowing programs to plan staffing and resources more efficiently. So again, the cost impact of this, it's, less overtime, fewer crisis escalations that are requiring for multiple staff in the organization to be involved in, and lower administrative burden tied to emergency responses. Also, staff burnout, which I know is one of the things that you'll be able to see a reduced cost of. So for staff burnout, this often stems from, working in constant crisis modes over time and, multiple times during the day. So when clients experience that stability in both housing and employment, staff report higher job satisfaction and a sense of impact. They can also experience fewer like more distress situations related to the unmet basic needs. Next slide, please. Okay, so now we're going to talk about what are some practical ways to integrate that employment support. But before we move on to a few like suggestions and strategies, on the next slide, we're going to talk about, we're going to have a short group discussions. We just want to learn what are some of the best practices that your organization has implemented for staff to provide employment support to clients. What worked, what didn't work. So, I know based on the comments earlier, some of you are already incorporating both of these models simultaneously. Some of you might not. Some of you might only be incorporating one of them. So is there anyone that would like to share? You can unmute or add to the chat just to see, what has worked well for your organization or maybe what's missing.
So is anybody, okay, we refer out and coordinate care with employment providers. That's great. Tim?
Awesome.
I'm sorry, go ahead, Rosie. Sorry.
Oh no, I was going to say the same thing. I see someone had their hand raised.
Yes. Hi, this is Tim. I'm not sure if you can hear me. Hopefully.
Yeah, we can hear you.
Okay. Yes. So I'm a resident service coordinator. I work with the Seattle Housing Authority. And we have a department called JobLink, which essentially is some of what we're talking about here, employment support. I often work with residents. I refer them out to JobLink. It's a wait list, so they have to sign an interest form, and then when the wait list is open, JobLink will reach out to that resident. I was thinking about like how well that works and how like it could be implemented. And one thought that I had, I guess, is that the resident has to be engaged, to be willing to engage with JobLink. They handle it off-site, so they go and meet with them, as far as I understand, off-site. So my thought is having more of this support on-site or more closely, tied to the resident, something like a job coach or a job support advocate who is more closely tied to the residents, because it's often where the resident needs to be interested and willing to engage in these kind of services. Otherwise, I don't know how effective it is in like actual practice. But it's good that we have it, and I do refer people often to it. It's sometimes difficult to see the like realities of how effective it is.
Great point, Tim. And I think that's something that's shared universally for a lot of organizations, even across the country, to see what are those benefits and what mechanisms are in place to track the the outcomes, because it's hard to track. So I get somebody a job. I think for me, retention is a great outcome to look at. Like, I can get somebody a job tomorrow, but are they keeping the job and for how long, right? Thank you for sharing that. And anybody else? What didn't work well? Is there anything that you could share that didn't work well? Is there any ideas that you have for improvement?
This is Deborah Thompson. I had commented that we sometimes cross-enroll clients when we're able to between our programs. And sometimes that can get sloppy. Sometimes it can get messy. And although it normally works well, sometimes who's doing what, or there's a little bit of a communication, lack of communication on who's doing what, or who kind of staying in your own lane, housing, doing employment, or employment housing. So we're kind of tackling that with some of our staff right now. But we're working it out.
Thank you for that feedback.
Thank you. And I was gonna ask just Tim one question. I know you just shared that you usually, your organization usually refers patients out, and because of that, sometimes it's hard to really see, what's actually if it's actually working, right? How many clients are actually being, having that employment. So is there any way maybe that you can receive some sort of report from them that they can share with you at the end of each quarter, or something, just to show you those numbers? Or not sure if that's being done or not.
That is a good question. Yes, I think that's a definite possibility. It's just my role, my position is I simply refer them out, and so I'm not closely tied to the outcomes, but I'm positive they track all that, and yes, we could probably coordinate with them to get more, in-depth detail.
Got it. Thank you. And I see someone else has their hand raised, so you can go ahead.
Dylan?
Hello, yes, my name is Dylan. So I'm a FCS program director for Catholic Community Services, and when I began, we had supportive housing and supportive employment, I think, and now we've gone to just doing supportive housing, because one of the issues we had with supportive employment was most of the folks we had would come in and they would be, receiving public benefits. And so if they tried to get employment, that would actually threaten a lot of their benefits, which would in turn threaten their housing. And then you get stuck in this feedback loop of like, people need to be employed to pay for their housing, but if they're employed and they get paid too much, then they lose a benefit, which actually sets them back in terms of their income. So we'd get in this loop where somebody would get housed, they'd want to get employed, but they can't be employed to the point that they would lose their housing. And all of these, it's much more of a systemic sort of challenge, right? Where like so many of these things are dependent on each other, but they will also be kind of contradictory. So we'd have a really hard time actually following through on the employment portion, because being housing first, we'd want to maintain people's housing, and that would often become a threat. So to me, I think like over time of being in this position, I've seen and I've heard a lot of like the philosophies, the aims, the goals of what we try to do. But I think when that's implemented into the systems that exist, it ends up kind of ultimately being self-defeating in a lot of ways, and we can't really get to the outcomes that we want without running into a lot of these barriers. I don't know if other people run into the same.
Dylan, that's a great point, because I hear that all the time too. And I'm not trying to pick on Kimberly again, but she may have a different view of that. But I think that is a big issue. There's really, sometimes there's not a bridge to independence, right? It's just like either you earned a certain amount and they cut you right off, or we see this push and pull of folks afraid to apply because they're afraid they may lose their benefits. Kimberly, do you want to chime in on this piece?
Oh,
If you're still
goodness.
here. No, I'm not
Yeah.
trying to put you on the spot. I know that you're passionate about this, so I don't know if you wanted to chime in.
Yeah, I mean, I understand that, because as a housing specialist, we ran across the same thing. People are obviously fearful of losing their benefits. And so, but we also want to talk about how important benefit planning can play in this part, where people can really understand what their benefits are able to do and what they can do work-wise around their benefits to not jeopardize housing. And I don't know if you all were around over the last couple of years, but we did have a bridge program called Glide Path that I managed, which is a supportive housing or supportive employment program, really to increase benefit planning so that folks can go back to work knowing what their benefits will allow, so that they understand the ins and outs of what their benefits are, and also how do I go back to work and still be able to move further into self-sufficiency. And so we did that for about 3 years, and unfortunately that program has sunsetted. But the idea really is that if we can support folks, and it is systematic, there are some issues with that. You make too much money, you lose your hen voucher. But really the idea is we don't want people to become dependent on those things either. So really having those conversations, planting the seed about, do some benefit planning, at least an orientation to understand what you have going in your benefits, and also how you can manage to work around those things, because there is ways to do that. And so I really encourage folks to learn who your benefit planners are in your community and really utilize those folks, because we don't want to just can't go back to work because you will lose your benefits. That's not always the case. And I get that the systems don't always work well with each other, but we really believe that, people can go back to work and still get benefits. It doesn't have to all go away. And part of it's easing themselves off of those benefits and into employment so they can sustain housing for longer. So that's
Thank
it.
you, Kimberly.
Go on all day.
Yeah. And your glide path program has been very successful. We've seen that. And so kind of sucks. All right. Guess there's a couple other questions. Kelly and then Sarah, or Sarah put her hand up. Kelly, Sarah.
I'm going to lower my hand. This is Kelly. Glad to be here. I overthought my question. I answered it myself. Thanks.
Okay. Sarah?
I was just
You're muted, Sarah.
I was trying to send a message in the chat, but it says I'm not a member of the chat, so I can't send messages. One of the barriers that I've seen, especially working in permanent supportive housing where our clients do have disabilities, is their inability sometimes to be consistent. And that is where the fear really comes in with the benefit loss is I'm feeling really well, I'm doing really well, I'm working really hard. It's been 7 months, and then I have some sort of like a health relapse, and I am not able to work for 3 months. And then what do I do in that situation, right? Like, even with like housing subsidies, it may take them a month to adjust their rent after they've lost their income, and then they're going into it already so far behind, right? Like I think that that's probably like the biggest challenge, because I know a lot of my clients, their ultimate goal is to get off of benefits completely and be able to be completely independent, but there's no real safety net in place for them once they've done that.
Bridge to independence. All right. Well, thank you. This is a great conversation, and this tells me that this is a conversation that still needs to continue. So maybe we can look at a future learning collaborative to delve more into that. But I will, all right, I need to figure out how I get back to the screen that I was on. Let me see. All right, there we go. Okay, thank you all for being transparent and sharing, and I'll keep going, Rosie.
Thank you. Okay, I know we're not too far away from 11 my time, so I'll try to speed up through these other slides and see if anyone has anything else to add. But again, if you have anything else to add for any of these, slides, any questions that come up, I encourage you to add it to the chat, and then we can come back to it at the end. We have another discussion question then. But I will be talking about what integration looks like in practice, what this does not mean, and what it actually does mean. So integration does not mean that, housing or clinical case managers suddenly become the employment specialist. Staff are not expected to be, cold calling employers or placing clients into jobs, 24/7, but it's, integration is about that communication and coordination and not so much, replacing specialized workforce roles. But supportive employment within an integrating, I have to remember that supportive employment within an integrating model is, voluntary and person driven. So employment is never used as a condition of housing or services, like you said, Nikki, earlier in the slides. So also, I know one of you was what someone mentioned earlier that, what do we do though if, clients are unwilling or, maybe it's not the right time. So we'll talk about that in one of the upcoming slides. But again, this does not mean, pushing employment on someone or, measuring success only by job placements, because there's a lot of different factors that go into this. But what this does mean is about asking about employment goals regularly. So, like employment is normalized and having that open communication evolves over time. So really asking like, what's your goals? How can we help you? What are some of the challenges that you're having? where is it that you would like to be placed at, and so forth, just so that we can learn more about that. Also, normalizing work as a part of recovery. So, work is presented as a pathway to purpose, to finding that routine and building that connection to our social, community and everything. It's not an expectation, but it really helps with recovery. Also consider, partnering with workforce and vocational providers. So, having that clear role alignment and warm handoffs to support with this coordinated care. And also coordinating benefits planning, as, we were just talking about right now. So, having the team support with making informed decisions around income, benefits, and timing. Next slide, please. Okay, so what are some practical strategies for providers? So, low lived integration strategies actually allow providers to better align supportive housing and supportive employment without really, having to redesign programs or expanding staff roles. So this can start by embedding, employment goals into existing service planning calls or, sessions, and routinely asking clients about, their interest of work and everything during check-ins. So again, we're embedding these employment goals into the service planning. Also, providers can consider inviting employment partners into case conferencing to support with that shared problem solving, training staff on basic work-related benefits counseling so that those conversations are well informed, and creating those warm handoffs to support supportive employment programs rather than just, referrals and isolation, and then they feel like they're just left alone. So creating those warm handoffs, and then using data to track employment as a stability factor. So I know some of you may have this already in place. Some of you, are not tracking this data. So really working to be able to track that more. So using data to track employment as a stability factor, not just a placement outcome. This, helps providers demonstrate that reduced crisis risk. Uh, you know. Demonstrate that stronger engagement and more sustainable recovery outcomes. Next slide. Okay, so now we're going to briefly talk about some common concerns and barriers. So I know one of the, sometimes we always hear like our clients aren't ready for that. So, we have to consider that integration does not require that immediate action. Sometimes this happens over time. But even if you might hear or a client
Are you frozen, Rosie, or is it me?
No, I can't hear her either.
I'll keep going just for time purposes. Our clients aren't, we talked about this, a lot of times providers will say, well, my client's not ready. It's kind of like the housing piece. They always say, well, they're not ready for housing. Same with employment. And Rosie, you froze. Are you ready to keep going? Sorry, I just wanted to keep the
Sorry,
train moving.
yeah.
Go ahead. No, it's okay.
Yeah, thank you. Sorry, I think my connection was just not working well. But yeah, another thing, we'll lose benefits. So benefits, is a real loss concern, but it's also manageable. So, having those basic benefits, planning or counseling helps the clients understand income thresholds, what are some type of work incentives that they can apply or qualify for, and what are some protections that they should consider before they make those decisions. The next one, like we don't have capacity. So, integration is not about just adding new programs or responsibilities, but it does rely a lot on partnerships with supportive employment providers who can also bring that specialized expertise. So providers can support, again, integration through warm handoffs, shared planning, and communication without really expanding like caseloads or even leading to burnout of the current staff working in that area. Also, employment causes stress. So, while employment can introduce, short-term stress at the beginning, figuring everything out, getting situated, long-term unemployment often creates more of that deeper instability, isolation, and can also increase crisis risk even more. Next slide. Okay. Um, so Nikki, I'll pass this to you, and then the following slide is also yours. You're muted, by the way.
Of course I am. So thank you, Rosie, for keeping me on track. So case study example, a typical supportive housing pathway, entry into housing, stabilization and trust building, exploration of goals, including work, supportive employment engagement, increased income and reduced crisis, and greater independence and stability. This is just a sample of a case study that we know that's a typical supportive housing pathway. And I'm going to kind of keep moving just to be mindful of time. And then also just remember that, under this current administration, a lot of the housing and the funding may be tied to employment. I just want to keep that in our forefront, why we're talking about supportive employment and connecting it to supportive housing, because as HUD emphasizes an outcomes and stability and employment driven, funding mandates, we want to make sure that we as an organization, you as an organization and a community are kind of looking forward and looking ahead of how can we still continue to keep people housed, because some people that are housed, I don't have the statistics in front of me, but there's going to be a mandated, if anybody's able-bodied, they're going to have to work a certain percentage of the time. So just keeping that on the forefront of right now is the time to start connecting with your supportive employment providers in the community to get people connected. At least let's find out how you get people connected. What are those resources in your community? Because it comes down to folks that are in a permanent supportive housing that's funded by HUD or maybe even a public housing authority. We want to make sure that you already have those connections so you can get people connected to employment and if they need that additional support. Because it's not just about like any like a Walmart greeter or whatever. It's about let's really make it meaningful for that individual and making it individualized and creating meaningful engagement and support for the folks. Medicaid, why this matters also is Medicaid focuses on those social determinants of health, right? And that's an all-inclusive. It's not, it's not just one thing. It's not just housing stability. It's all of these other social determinants of health that maintain somebody's stability within the community. Workforce systems seeking non-traditional job seekers, right? Right now, there's a lot of folks, a lot of non-traditional job seekers that are needing to be integrated into the workforce system. And it's increasing pressure to demonstrate the cost effectiveness of your programs. So by having supportive employment connected to your supportive housing programs, you can talk about the cost effectiveness. And again, data tells the story. And how do you create stories out of the data that you're collecting to continue to receive funding? And even through like HCA, where they may be asking you, so tell us about cost-effective solutions, tell us about how you're connecting to supportive employment to maintain your supportive housing programs. And employment strengthens your funding narrative. So when you're asking for funding, or if you're a nonprofit, or you're a housing provider, whatever you are, the employment that you're connecting folks to, that strengthens the narrative when you're reapplying or newly applying for funding opportunities. And I really like this picture that Rosie put in here, the inflow of prevention, experiencing homelessness, supportive services, coordination, outreach, and then the interim shelter, then the outflow is permanent housing. So in summary, I'll do 2 of these and you can do the rest, Rosie. So here's some of the key takeaways for you all as providers. Supportive housing works, and supportive employment makes it stronger. And employment improves stability, health, and dignity. And I also want to include, it strengthens people's self-esteem and makes them really feel a part of community. Rosie, you want to do 3, 4, and 5?
course, yeah. So the next one, a key takeaway that cost savings increase with when income increases, because as we talked about, when someone does have both supports in both housing and employment, this can lead to a reduced rate of hospitalization or any crisis care in the, long run, which, this is where a lot of cost savings comes in. Also, integration can be flexible and provider driven. So again, really supporting the clients with that. And then this is about expanding opportunities, so not raising barriers. So, really providing them with that opportunity to be able to get both of these supports at once can really support with, reducing those negative healthcare outcomes in the future and really supporting them with that along the way. So helping them to reduce some of those barriers that can come alongside. Not sure, Nick, if you want to add anything else.
No, I think that's good to kind of talk about the takeaways, and we'll leave the last 4 minutes to talk about closing reflection.
All
I don't
right.
know, I can't remember if you were reading that, Rosie, or
Yeah.
I was.
Yeah, so for the closing reflection, so what would you change for your tenants and your staff if employment were treated as a core stabilizing support rather than an optional referral? So you can feel free to, if you want to mute, raise your hand or share on the chat.
I mean, and you guys don't have to respond directly to this closing reflection. Do you have any closing reflections around what we discussed today? Any takeaways?
I'd like to say something just really quick.
Yes, please.
Um, I think if we treated it as a core stabilizing support rather than optional, I feel like there wouldn't be so much stigmatism around mental health. And I mean, we are coming into a world where we are allowed to have those hardships, but I feel like it's still frowned upon. It's not supported. I think if we made it a core stabilization, we could even start it from younger. There's individuals who go into being homeless or, foster care aging out at 18. So I think if we, sorry, I'm at home with a sick child.
Okay, it's okay.
Um,
No, it's okay.
but I think if we start it from younger, then we could really educate and maybe we wouldn't have so many adults experiencing these outcomes. They would have had the education, like most people want when they come out of high school. They wanted to learn about taxes, they wanted to learn about these things. They weren't taught. And so I feel like teaching them from a young age or an appropriate age, it would allow them to have that stability early on.
Anybody else had their hand up?
I was just going to add that I've noticed under the current administration, as DEI initiatives roll back, I'm seeing less and less opportunities for the young people in my programs, especially those who struggle with like obvious mental health issues on a day-to-day basis, where, and I think that's only going to continue to be more difficult as we see more of that DEI rollback and also uh I guess just general funding going away for different programs for people who are struggling with those things. And as a result, we always are going to see more homelessness again. So it feels like a rough cycle.
Totally agree. That's a great feedback. And we have time for one more. Thank you so much for sharing that. I totally agree with you. But I
There's
want to
also a
give
comment
props
on the
to
chat.
Washington.
Oh,
Oh,
sorry.
sorry. Go ahead. No, please. No, go ahead.
No, I was gonna say
I'll let
there's
the
also
person
a
talk.
comment on the chat.
No, go ahead, Rosie, please.
I was saying that there's a comment on the chat. Someone else said, I agree. I think there's a lot of stigma with mental health, most seen as, they haven't grown up, but weren't really given those tools to succeed or work on their mental health.
right, Kelly.
I wanted to thank you all for the training. I really appreciate how Rosalinda tied in that about recovery. Someone that has lived experience. I was unhoused, and I, like, literally based on my choices, was unemployable. And some people took a chance on me. I am the evidence of what supportive services look like. It wasn't it wasn't FCS or anything like we have today. But I was scared to lose my benefits, the what ifs, the what ifs. And now that I'm employed and housed, I still have some of those what ifs, but I'm able to then be more passionate with my participants and be there with the peer lens that you can do this. I know you can do this. You said this is your goal. Let's take a chance. Doesn't have to be tomorrow, doesn't have to be today, but I get to cheerlead them. So I just really appreciate the language used today.
Appreciate your vulnerability and sharing your, I call it lived expertise because you are an expert. You, this work, should be always grounded in people who with lived experience. And without you, a lot of these programs wouldn't be, people like you, a lot of these programs would not be successful. So thank you. All right, well, we're 1 minute past and I have to jump to another meeting, but I so appreciate you all showing up today authentically and sharing your experiences. And we want to continue to enjoy this partnership we have with Washington Healthcare Authority. You all are amazing in the work that you do. Rosie, you have any last words?
No, just thank you everyone for allowing us the space and also for sharing, more of the best practices, things that you all have been working on. So again, it was really nice to meet you all and thank you for allowing us to be here today.
Take care. Have a great weekend. All right, go Hawks.
See?
Bad Bunny. All right. Take care, everybody.
Thank you all.
Thank you. Have a
Thank
good day, everyone.
you.